Good evening, guys. Now I have discussion D for you. We're discussing the life of a deaf doula. Okay, I've got a presentation made for you. So here we go. The rapid rise of deaf doulas, non medical professionals who provide emotional, spiritual, and practical supports. At the end of life, signals a structural gap in the U.S. care continuum. Families increasingly seek continuous presence, guidance, and culturally attuned support that hospice and the medical system are not designed to provide. This brief outlines the policy, opportunities, and regulatory considerations for integrating doulas into end of life care with a focus on equity, workforce modernization, and system efficiency. The U.S. end of life system is strained. Hospice staffing shortages limit time with families. Caregiver burnout drives avoidable hospitalizations. Many patients enter hospice too late to benefit. Families lack navigation support during crisis. Emotional and spiritual needs often go unmet. Doulas are emerging to fill these gaps, but the field is unregulated, unfunded, and unevenly accessible. What death doulas do? Doulas provide non medical support, including vigil presence and bedside companionship, education on signs of active dying, family conflict mediation, legacy projects and meaning making, advanced care planning facilitation, grief support before and after death. They do not replace hospice or clinical care, they complement it. Why the role is growing. Rising demand for personalized relational end of life supports. Public destigmatization of death and dying. Increasing complexity of home based care. Workforce shortages in hospice and palliative care. Growing training infrastructure. NIDA. Lifespan Doula Association. policy opportunities, workforce recognition, and standards. Policy lever: create a state recognized role category for end of life doulas, similar to community health workers or peer support specialists. Benefit: clarifies scope of practice, protects families from misrepresentation, enables future reimbursement pathways, supports workforce development and training pipelines. Recommended action: develop voluntary certification standards with stockholder input, hospice doulas, palliative care consumer advocates, Medicaid and public financing pathways. Policy lever: expand access through targeted financing. Options include 1115 demonstration waivers to pilot doula support for high need populations, Medicaid HCBS waivers to include doula hours as caregiver support. Give me 1 second, guys. Paper stuck. Hospice add-on payments for continuous presence or caregiver coaching. Value-based care models that reimburse for reduced crisis utilization. Rational: doulas can reduce avoidable ED visits, emergency department visits, late hospice enrollment, and caregiver collapse. Outcomes with measurable cost savings. Integration with hospice and palliative care. Policy lever: encourage hospices to incorporate doulas through contracted doula networks, hospice employed doula roles, volunteer doula course, partnerships with community-based organizations. Key regulatory need: clarify boundaries between doulas and hospice to avoid scope of practice conflicts while enabling collaboration. Equity and access: without public funding, doula care risks becoming a luxury service. Policy levers: fund community-based doula programs in underserved areas, support training for doulas from marginalized communities, integrate doulas into culturally specific end of life initiatives, provide grants to faith-based and grassroots organizations, equity rational, culturally attuned support improves trust, reduces fear, and aligns care with community values. Data evaluation and research. The field lacks standardized matrix. Policy lever require evaluation in any publicity funded pilot. Key outcomes to measure: caregiver burden, hospice utilization patterns, hospitalization rates, patient and family satisfaction, bereavement outcomes. Goal to build an evidence based, inform long term financing and regulation. Implementation considerations: regulatory balance, avoid medicalizing the role, maintain its relational community based nature, workforce pipeline, partner with community colleges, public health programs, and doula organizations to build training pathways, cultural compliance, competence, support doulas who reflect the communities they serve, sustainability, tie reimbursement to measurable outcomes, not hourly tasks. In caring for an older adult, you are also caring for the future uh, version of yourself. You are shaping the world you hope will exist when it's your turn to need help. Elder care matters because it works. That keeps us human. Okay, ice. And then death doulas are not a fragile trend. They are a response to unmet needs in the end of life system. Their rise offers policymakers a chance to strengthen family support, reduce avoidable medical utilization, modernize the end of life workforce, advance equity, humanize the dying process. Integrating doulas thoughtfully can help build more compassionate, efficient people. All right, so that is your C for tonight. Um, I will try to jump on later and do a D. For now, Gator Wellness, take care, folks.